Member for Peace River North.
Sorry, I just dozed off there. Thank you to my colleague from Prince George, Valemount, and Chair, the time to ask, in my case, just one, I say simple question, but questions are obviously never just that simple, right? So I'm sure that over the years, the minister has probably received some sort of correspondence from either Margaret or Jim Little up in Fort St. John. Margaret is with the Save Our Northern Seniors organization. I'm sure probably others have received emails from her. She is quite the advocate for seniors issues. And one of the questions that she had and others have and I'm curious about is the third house of Peace Villa long-term care, which there is quite a few people on the waiting list for that facility, and I'm sure that it's the same around the province. Waiting lists tend to be a regular thing. There is a fear amongst the seniors community that seniors are going to have, no other way but to be forced to leave their community, which is the worst thing, where they have family and such in their home community. It's an understanding that this has been in front of Treasury Board now for the last 6+ months. Just wondering if the minister can give us a bit of an update on when that might be coming forward.
Minister.
Well, thank you very much, Honourable Chair. And yeah, we do have on a number of Northern Health capital projects, and obviously not just in Fort St. John, but in other communities. I think in Smithers. I think we have work we're doing with nonprofits in Prince George, the Providence Living, which we don't often always think of as a nonprofit. So those are items that they're not before Treasury Board in the sense that they're scheduled at a meeting, but they're at the stage where business plans have been developed by the health authorities. So there's a series of such projects around BC that are at that stage, and I may be talking to your colleague from Cranbrook soon. Not that I favor him over the honourable member in any way, shape, or form. I don't want to suggest that. He's a better curler. But in communities such as Cranbrook, if the member will know, and members will know who are from Kelowna, there's a facility in Kelowna called Cottonwoods, which is doesn't do well under what we call the facility condition index, for example, and there are facilities around the province in those circumstances. We have and are investing and have a larger capital envelope, and so we'll be making those decisions about the order of investment. But certainly this is one of the projects that's at the business plan stage.
If I might just...
Member?
Sorry, sorry, Chair, if I might, as a real quick follow-up then to maybe more cement the response. So it doesn't sound like it's even in front of Treasury Board. It's still in the process of being prioritized and worked on. Can the minister give us some sort of idea? Are we looking at decades? Are we looking at a year? What are we looking at as far as something that I can take back to the residents of Fort St. John?
Minister.
Well, tell Margaret and Jim hello, first of all, and wish them my very best. And I say that with a little bit of kidding around, because I know them and I know how determined they are, but also they're the kind of people that every community needs, that are really advocates for public health care in communities. So I'm appreciative of that. No, when you get to business plan stage, you're well along in the process. And I think it's fair to say that in a number of communities in Northern Health, Fort St. John in particular, there are two sets of needs that I think are important. Obviously, there's all of the challenges that come out of the hospital, and those are the health human resources needs that are everywhere. Secondly, there's some primary care needs, because it's a relatively young community, which means, and younger people have less attachment to a primary care provider, and so that's something we'd like and we want to work out to address, and that's a primary care question. And the other is seniors, being able to live a full life in the community, as the member says. So those are priority projects in a number of northern communities around the province. In Northern Health, it's hard to imagine where the member is that Quesnel is in the Northern Health 30, but it is. There's a project there, for example. There's obvious demands in Prince George. But I would say this just in general, that there's a long-term care question, but there's also the housing and seniors housing question more broadly. Sometimes it's in assisted living, but senior housing more broadly. There are places where it may not be possible to build long-term care, where we have to have housing available for seniors where they can live in community, if not through their period in long-term care, but at least live in their communities. There will be in the member's own constituency. Fort St. John is a major center, as is Dawson Creek in that other Peace members constituency. And those are important investments. But we now have life expectancy at the age of 65, which is basically 23 or 24 years. When you think of the start of the Medicare process in Canada, that was more like 8 to 10, right? Life expectancy at 65, right? And so there's a longer phase of need there. Yes, there's a long-term care need, and the Peace Villa developments are about that. But also there's other needs such as assisted living and seniors housing needs that are particularly felt in northern communities, because as a practical matter, the housing question, you're talking about a housing question for people who may have resources, but no way to spend those resources in their community that's practical for their life and their way of life. So those are things that we have to work on. But on long-term care, we're going to see significant investments in the next few months, I think, where we're starting to build projects, letting projects for tender across the province. You've seen the beginning of it. There's one in the western communities, in the community of Colwood, where there's obviously an increasing demand for seniors. There's one at St. Vincent's, which is in Vancouver, but it's a replacement with increased capacity in that community, which is Providence Healthcare, which is near the BC Children and Women's site in Vancouver. And then there are projects all over the province where we see that need. And you can tell the member for Kootenay East that I'll be expecting him.